TMJ is like a problem with the jaw, the joint in your jaw, and I clench my jaw a lot, so it brings pain to my jaw and my head, and it's not comfortable.
Melissa's had issues with TMJs for a very long time. Probably in the past few years now, BOTOX has come up with treatments for TMJ patients, TMD patients, patients who have issues with their joint or even migraines and things like that. So again, essentially BOTOX came around to smooth out wrinkles by decreasing muscle activity. Well, what causes these type of jaw aches and migraines is muscle activity. You've got these large masseter muscles here that when you clench and grind, it causes a lot of pain. Migraines is the big temporalis muscle over here, which kind of constantly contracts, causing these migraines. So essentially BOTOX is just decreasing that muscle activity.
I would tell someone to come here for TMJ because, they're just so nice and they make me feel comfortable, and the TMJ procedure is not that bad at all. It's not painful, and it really did help me.
So it does work very effectively, but TMJ is one of those things that we do start off at a baseline. We have to kind of evaluate in 3 months how much relief did we get, and then we may have to increase or even decrease after that as well. Today we have Melissa here, and we're going to be doing her TMJ treatment with BOTOX. So a lot of people don't realize that BOTOX is used for TMJ as well. So some of the issues that she's had is just a lot of tenseness right here in this big masseter muscle. There's large chewing muscles over here, and sometimes when patients grind, they'll grind their teeth, and in the morning they'll wake up with really a lot of intense soreness. So essentially what BOTOX does for cosmetics is we're relaxing the muscles, and that's how we get rid of wrinkles. So with TMD or TMJ patients, we're essentially doing the same thing, but not for cosmetic purposes. We're just relaxing those muscles so she's not flexing them and clenching them as much. She did have treatment about 3 months ago, 4 months ago. Unfortunately, at that point, it didn't last as long because she had some extreme other dental work done afterwards, which put a lot of stress onto her muscles as well. This time, I think all of her dental work is all done, so this is the final of it. We give the final treatment of BOTOX, and we've kind of discussed other treatments with it as well, like getting a mouth guard. Using TMJ BOTOX treatment with mouth guards will really help and benefit her a lot, but we're going to start off with the TMJ BOTOX treatments today. So we've already got her all prepped up and ready to go. As everybody will see, this is going to be a very quick treatment, kind of similar to the treatment we did with cosmetic BOTOX. These injections are very quick, very easy, very painless. And we're going to give, last time we actually started off with about 20 units per side. Because it didn't last as long, and she got about, I think if she didn't have any dental treatment, it would have lasted longer. But because the 20 units only gave her about a 70 to 75% relief, I'm going to bump it up to 30 units this time, and hopefully maybe give her 80 to 85, maybe hopefully lucky up to 90% relief. It's very difficult to give the full 100, and we don't want to jump up and give her 40 units. We'll just start off with 30 and see if that helps out. So we're going to go and start on the right-hand side here first. So first we're just going to have you clench down really hard. I'm going to grab this really thick masseter muscle right here. Okay, that's 20 in there. Go and clench again. That's it on that side. Feel okay? Mm-hmm. All right, I'm just going to kind of push it back into the muscle. And just like with cosmetic BOTOX, we don't want the patients to touch the area or mess with it for about 48 hours. Go ahead and bite down and clench. Okay, that's 10. And the last 20 here. That's it. Everything okay there? Mm-hmm. Any discomfort when we put it in at all?
No.
And again, just same with cosmetic BOTOX, she's going to get a little welting here. It's not going to be as noticeable because these muscles are taking over the big welt area. A little bit of redness, and that might last for just about a couple of hours, and everything should go away. And so that's it with the treatment. We've given her 30 units per side. Again, with the BOTOX treatment and alongside maybe with night guard, I think she's going to get a lot better result. And because she's had it every 3 months now, as long as you keep up with it, in about a year, you may be using less units and coming in less often as well. Maybe not every 3 months, maybe every 6 to 9, even up to about a year if you continue with treatment.